You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Peach State Payments, ethical processing, more profit, less stress. Chiro HD, more than an EHR, practice management simplified. The Chiro Speaking Company, attract, educate, and convert. Chiro Spring, cloud-based, user-friendly software with all the essential features chiropractors need. Rudman Relight, the IFCO, Chiro Moguls, Chiro Health USA, Sherman College of Chiropractic, Pure Chiro Notes, Titronics, and Life West College of Chiropractic. Let's hustle. This episode of Chiro Hustle is brought to you by Relight Hydration by Redmond. Here's the truth. Most Americans are walking around dehydrated, low energy, brain fog, muscle cramps, afternoon crashes. And many people think they just need more coffee, when they actually need more electrolytes. Because hydration isn't just about drinking more water, it's about the minerals. Your body relies on electrolytes like sodium, potassium, and trace minerals to help your cells actually absorb and use the water you drink. Without those minerals, water alone doesn't do the job. That's where Relight Hydration comes in. Relight is built around Rudman Real Salt, a natural, mineral-rich salt harvested from an ancient seabed in Utah. It provides the foundational sodium your body needs for proper hydration, along with balanced electrolytes to support energy, muscle function, and daily performance. No artificial dyes, no unnecessary fillers, just clean electrolytes built around real mineral salt. Because at Redmond, we believe the secret's in the salt. If you're new to Relight, start with their sample pack so you can try multiple flavors and find your favorite. Once hydration becomes part of your daily rhythm, you'll feel the difference. And chiropractors understand this well. The nervous system runs on electrical signals, and electrolytes help support that communication throughout the body. If you're tired of hitting the wall mid-afternoon, it might not be more caffeine you need, it might just be better hydration. Go to chirohustle.com and get 25% off of Relight with their exclusive promo. Hydrate smarter, move better, stay aligned.
Hey guys, welcome to episode 761 of the Chiro Hustle Podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we have the opportunity of interviewing Dr. Bjorn Nelson. And if you want to hear a conversation about a third-generation DC from a big Chiro family and leadership in the state of South Dakota, stay tuned for the full episode. Welcome back, guys. James Chester here with Chiro Hustle. I have Bjorn Nelson on with me coming from Spearfish, South Dakota. And this is episode 761. It's our 761st iteration of the Chiro Hustle podcast. I'm really thankful to have Bjorn on with me. I just spoke up at the South Dakota Chiropractic Association's event a couple months ago. And it's really cool to make friends with this guy and get to know him better. And I just want to let you know our big why. Then I'll give you some topics that we're going to cover today on today's episode. But big why do we do over here at Chiro Hustle? Well, first things first is freedom of speech. We believe that that's so important to the legacy of chiropractic and autonomy of the individual. We also believe in medical freedom and family health freedom. They are not the same things, but if you need help with those topics, find a chiropractor in your city, and I'm sure they'll help you find direction for any questions you might have. Thirdly, we believe in innate intelligence, universal intelligence, and the educated intelligence. And we also protect B.J. Palmer's last written words, which is called the sacred trust. If you guys got students in your life that might have gone to a school that they don't teach them philosophy, please share the show with them so they can get a better understanding of what chiropractic actually is. On today's show, we're going to talk about him being a third-generation chiropractor from a big Chiro family and leadership in the state of South Dakota, plus a couple topics that he was really interested in discussing. We're going to talk about women in the chiropractic profession, how they'll change the future. And I think there's something of over 50% of students now in chiropractic coursework that are women. We're also going to talk about the trajectory of the idea of a chiropractic hospital and what that looks like. And what we're doing for the future and how we're creating a legacy. And without any further, Dr. Bjorn, welcome to the show.
Hey, thanks a lot, James. Yeah, thanks for having me.
Yeah, so let's break right into this one. Just kind of share your origin. How did you decide that chiropractic was right for you? I know that you said before the show you're born into a chiropractic family and adjusted probably like 2 hours old. So just tell us a little bit about your story as the chiropractic story you have.
Yeah, so like you said, my father's a chiropractor. He's a first generation, and my mom's side, she comes from a family of three brothers and two girls, and she's the eldest. And her father was a chiropractor, and then all of her brothers are chiropractors. And so one of my mom's brothers introduced my mom to my dad because they were chiropractors together in South Dakota, and then they got together, and obviously the details there, but they had two kids. My brother, he's older than me, and then myself, and um, yeah, and I mean, chiropractic has been, since I was born. I mean, I was adjusted probably, like I said, within 2 hours of being born. And then it's just, I mean, in my mind, going to family events, I mean, table was out, people were getting adjusted. It's just like, that's what the lifestyle was. And you don't even think of that that's actually anything or any kind of, positive thing in your life until you're removed from it, right? And so most of my life I was getting adjusted through uh, high school. I was an athlete. I was getting adjusted by my dad through numerous things. I broke my wrist. My dad would be putting a cast on me. I mean, everything that you know about chiropractic, that was just like my lifestyle. Like, for instance, my dad didn't even let colored cereal in our house. He thought it was poison. So I never even had a colored cereal or any kind of, uh, Oreos or anything. There's nothing until I was like out of high school. Like bunches of oats was the cereal that he recommended. So it was like all this deep philosophy, and then he would talk to me about like these guys like Dr. Jancy, of National back in the day, and these old Parker chiropractors and all these things that he'd fly down to Texas and listen to so I mean, since I was a kid, just knowing all this stuff, and college came up, and I went to school to be a field goal kicker, actually, in a small university in Montana. And I started, going and be like, oh, I think I want to do this or that. I wanted to go into psychology. I wanted to go into military. I mean, I was just a young kid. I was 19 years old, didn't know what I was going to do. But during college football, I was always getting injured, hurting my legs or whatever. And my dad's like, you got to go see a chiropractor in Billings. So I went to a chiropractor in Billings, and her name was Dr. Bear. She was like on the campus where I was going to school, and she was awesome. I mean, she was a female, and she did everything that I needed, and she was awesome. And she didn't even charge me anything, which I didn't. I was wanting to pay, but she's like, no, you're a chiropractic kid. Your dad's a chiropractor. She never even met my dad, and she was working on me, and so that kind of changed my mind. I was like, oh, that's awesome. Then my dad would come and watch me on my football games. And I remember a couple of times my pelvis was out, my legs were hurting, and our trainers didn't really know much about other than, stretching and icing and stuff. But he was always like, let me adjust you. And then, because I come from a big chiropractic family, he brought one of my old uncles who was a chiropractor. I mean, this guy's like in his late 70s and 80s. And he's like, well, let me work on you, Bjorn. And I was like, love it. So he was working on my pelvis just on this bench outside the football locker room. And all the football players are like looking at me. And he was working on my pelvis. I mean, this guy's like in his late 70s, early 80s, adjusting my pelvis in a way I'd never really been adjusted like that. And I was like, oh, so I played the game, but ever since that moment, I was like, you know what? These guys this is something else. And so yeah, so then I decided to go to chiropractic school. I I enrolled in Northwestern, and then I applied to Northwestern National. And again, going back to that chiropractic roots and family, the president of Northwestern called me up personally and was like, "Hey, I know your dad. I used to practice in South Dakota. You got to come here. This is where I want you to come. My kids are here. They're going to chiropractic school. You need to come here." And so I decided to go to chiropractic school at Northwestern, drove to Bloomington, and yeah, stayed in some really dimpy ass, apartment. And I really enjoyed my chiropractic experience because again, then I was just like, you start going through the schooling and all that, and then you're like, man, I really know a lot about this field and this science and this art and this philosophy. And then from there, I just did like a lot of things in chiropractic school. I started an organization called NARTS where we called it Northwestern Arts. So what I found out at Northwestern is all these awesome chiropractors were also like artists as well, with if it was mosaics, paintings, whatever they did. We created this huge organization. We had like parties and people would just display their stuff. So, that, I mean, I could just go on, as you can see with my chiropractic journey, but um, it started pretty light. And then when I was there at Northwestern, I met my wife, and she's a chiropractor. And so then we got married and came back and took over my dad's practice, which is at 50 years this year in practice. He started in 1976. And so it's my wife and I and my dad. We still practice together. And my mom works for us. My brother used to work for me. I mean, we just got literally a chiropractic family in Spearfish. And yeah, the rest is history. We just celebrated 10 years of practice in Spearfish, and it's been awesome. So that gives you a little bit.
I don't think the most important table in your house is the dinner table. I think it's the adjusting table.
Yeah, you know what we have in my basement, and it weighs about as much as a car, is a Zenith High-Low, the classic. And and so when my kids love it, they'll go down and push the pedal and raise you up. And then they get on, and then we raise them down. Yeah, it's it's awesome. Yeah, it is the most important thing. It's downstairs. It's an old leather Zenith high-low brown. I think it's probably from the 1970s.
And
Yeah.
that's when they used to make cars really big too.
Oh, it is. And the funny thing about that is how my dad always did. Like if there's a young chiropractor coming in to like practice around, or we know them, or there's an intern that became a chiropractor, my dad's always like, I got a couple tables. We'll sell them to you for $100 and we'll buy them back from you when you're ready to get rid of them. And it's always the Zenith High-Low. And so they'll like drive up to our clinic and it'll be this. They're like, oh, I'm ready to come get those tables. And it's like four of us trying to get in the truck. But yeah, anyway. Yeah.
Well, I think, just talking to you, it's amazing to hear how chiropractic has been such an important part of your life and how you just celebrate 10 years in your own practice with your dad, and he's been doing it for 50. I mean, what a legacy. What has it been like to practice with your dad?
It's pretty awesome. I was reading your questions about, some stuff that we're gonna go over, and like chiropractic miracles and stuff like that. And practicing with my dad's old school chiropractor. He's from the golden ages, which I think is we're gonna lose these guys soon. I mean, they're that baby boomer generation, which we're the largest generation in the world, right? And we're going to lose a lot of those chiropractors, and it's really going to be sad. But that being said, my dad's that golden generation where he's like, nope, this person comes in, you got to just see one, you got to. And I mean, I've seen some of the craziest cases of 50-year-old practice. I don't know if you get a lot of these guys that talk about this, but when you come into a 50-year-old practice, the things that you see, no, you don't get taught in chiropractic school. And majority of the chiropractors that I did internships in like the cities, they would tell those people to go to the ER. They're like, I ain't treating you. My dad's like, hell no, get him in the office. Let's work on him. And so that just being around that and witnessing what my dad has. And my wife and I always joke that my dad's just got balls of steel. Something comes in, he's all in. He's going to take care of him, and he's going to do as much as he can to take care of him. And he also was that mindset of like, oh, they need a supplement. Their first supplement is for free, and stuff like that. And you want to, when you come into practice, it was really hard for my wife and I, because we got these new ideas, we think we know a lot and all that, but you always have to step back and look at a guy like him and say, he's been making it happen for 50 years. Obviously he's doing something right. You know what I mean? Look what he has. He's got a beaut. I mean, he had this huge chiropractic office with multiple units, with a bunch of different spaces. And then he's got this beautiful house. And, my dad he just was super successful. And he was like the president of the state association. He was part of the board of examiners. I mean, he did it all. And he's been a pioneer, and it's just so awesome to be around. So,
Yeah. And I think, just you sharing that aspect of, coming in and practicing with your dad and how old school he is. I'm sure you learned a lot just being around as a kid, but actually being a professional. I'm sure that was a huge eye opener for you too. Based on that, you learning from your dad, and him just doing all that with his own two hands, right? And building that legacy for his family with his own two hands. Like, it's something to just be really, to admire. I think we have to admire these, I call them legacy practices. When docs practice over 30 years, it's really a legacy. And I wish in my viewpoint, I wish that more young DCs had a chance to go in and work with an older doc, a seasoned professional, and actually mentor with them and practice with them and keep the ego aside and learn how to actually have like an apprenticeship, if you will, or have some type of, like, in the medical world. I know we're going to talk about chiropractic hospitals, but in the residency world of the medical world, like, you go and train with other professionals, and you don't have this journeyman idea that you got to go build it all by yourself. So I think it's really interesting. And I think we should get your dad on the show.
I really do. They call him the cowboy chiropractor. And because what he did to really start his practice is he was at the rodeo, sitting behind the chutes of the rodeo and working on cowboys, coming off all cowboys, cowgirls, cowboys, you name it. That's what he did. And he didn't charge anything, and he still doesn't. And he's been doing that for like 30 years. And in our office, we have an area right when you walk in, that's all the pictures of these cowboys that he's treated. And it's awesome. And yeah, you're right. He's a classic guy. He's going to be 76 this year. And yeah, he has, and I always ask him about certain things. Like, we always are going through different things in the state association about laws or stuff. And he's always that guy that is like, God, I'm going to ask him what he thinks. And then he'll tell me something. And I'm like, dang, I never really thought of that. So it is. Yeah, it's been a major pleasure. He wants to work till he's like 80. He says when his hands are shaking, then we should walk him out and tell him he can't see anybody anymore. But when you got to practice at 50 years, you got patients that only want to see you. They've been seeing him since he's seeing 3 generations of kids. It's crazy.
Well, hopefully I get a chance to meet him one of these days when I come up there to South Dakota.
Oh yeah, you will, for sure.
Let's talk about some advice for students. I know you weren't there too long ago, 10 years out. But I know that the opener was women in chiropractic. What's your message about the future of chiropractic with women included, and maybe some advice for students all in the same question?
Yeah. Well, I mean, I have a firsthand experience of working with a female chiropractor, my wife, and she's amazing. And what people see in women in chiropractic is different than I think with males. I think it's kind of that Mother Teresa effect going on. And I don't care what type of human it is out there. Everybody loves that womanly touch, physical or metaphorical or whatever you want to say. And it's different than a man's like a masculine touch or a male's touch. And I think it's super, super powerful, especially for the chiropractic profession, is because we've had this such a male driven profession. If you look at the very beginning to where it's at now, um, and now women are coming up, and I think it's awesome because, like I said, they're bringing another aspect to chiropractic that I can't even I can't predict it. But what I do know is she beats me every year in numbers, chiropractic numbers, by 100. And so when we look at that, my staff brings every month we look at our numbers, and then I tally them up. And then the staff look at me and they're like, "Your wife got you by like 100 patients this year." And I was like, and I'm not even ashamed of it. I'm super happy about it because, and that's where I was like, women in chiropractic, it's another thing. They have a different touch. They have a different way of looking at things. They have just a whole different thing. And like I told you, I've been raised by chiropractors, and guess what? All the chiropractors that I've seen, males. So now we're getting these females. I just think they're going to take our profession to another positive level. I'm not saying that we're not going to continue to do it. I just think it's a nice thing to show what we're going to do. So when I see these women chiropractors, I'm like, awesome. You're going to bring something so much different to your community than, I mean, you look at these communities like, okay, how many male chiropractors are there? Oh, shoot, they're all males. There's no females. I'm like, look at your opportunity. People are going to cling to you because of you're a female, one, but two, because you have a whole nother approach about it. And the other thing is, and if we're looking at the kind of like the straight mentality, having a really good looking woman work on you, that's another level, man. Have you had that? You're like, whoa, this woman is very beautiful and she can adjust me. Whoa.
You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Peach State Payments, ethical processing, more profit, less stress. Chiro HD, more than an EHR, practice management simplified. The Chiro Speaking Company, attract, educate, and convert. Chiro Spring, cloud-based, user-friendly software with all the essential features chiropractors need. Rudman Relight, the IFCO, Chiro Moguls, Chiro Health USA, Sherman College of Chiropractic, Pure Chiro Notes, Titronics, and Life West College of Chiropractic. Let's hustle. Hey docs, let me ask you something. Are you adjusting patients but not adjusting your revenue? Because a lot of chiropractors are still undercharging without even realizing it. They're accepting insurance allowances that are just too low, and they're hesitant to raise the fees because they're worried about pushback from patients. The problem is, when your fees and financial systems aren't aligned, it creates a slow leak in your practice. And when you try to grow, more marketing, more patients, maybe even another location, the leak gets bigger. There's actually a smarter way to handle this. Chiro Health USA helps chiropractors charge appropriately when insurance is available while still serving cash or limited benefit patients through a compliant discount medical plan. The results? Many practices see revenue increases around 15 to 20% without adding more visits. Same patients, better margins, more freedom. If you want to stop leaving money on the table and build a practice that's both profitable and compliant, check out chirohealthusa.com to learn more. Well, I was thinking more from the nurturing angle.
Well, yeah. I mean, obviously the nurturing like is a thing, but what I'm saying is, with women, it's it's so many different senses, nurturing, all those. And that's what I'm saying. And I didn't even know this until I had a wife that was a chiropractor and how much she's just amazing at what she does. And then when I'm in the state association and working with women, their creativity is a little differently, how they process things. And it's just fun to watch. And so, yeah.
Well, I'll tell you, when I speak on stage, typically, um, the women that are in the audience that are chiropractors, they have a different way of approaching, and their gratitude is different, and the way that they process the profession is different, which I really appreciate too. And I could tell you, like, I just counted like how many DCs I have in my cell phone the other day, just because I'm going to do a bunch of marketing coming up in the new year. 900 DCs, bro. And I'll tell you, like, the amount of women DCs that I have in my cell phone, just friends, like, they are the first to reach out, and the first to like always congratulate. So it is a different mindset when you think about like what they bring to the profession. And when you're talking about your wife and the different, uh, the energy she brings, I just think, women chiropractor are more nurturing. Men are like, let's see how quickly we can process and, take care of the issue in front of us. And I just think it's a different mindset. I know a lot of like couples that are both, women and like married couples that practice together. And it's always very interesting because a lot of women go to chiropractic school, they find themselves a guy like you, they get married and they become career moms. So it's really cool to see that you can balance out the mom lifestyle and the practice lifestyle and still have fun with life, because you know a lot of, like, what I've noticed is a lot of people hook up and become couples when they go to chiro school, and now they're going to practice and it's one or the other practices, but it's cool when you can see both practicing. So kudos to you guys.
Yeah, and it is. I do see that a lot. You see like the wife and the husband, then the husband is dominating the practice or whatever it is. And ours is completely 50-50. She makes as much as I do, and we go in, we work a lot together on certain cases. The other thing is when we were first starting out in practice, it was stressful, taking over my dad's practice, kind of changing some different things. At that time, we were going into electronic health records. I mean, there was a lot of changes, staff changes, and it was stressful. And then being on top of your documentation and doing all that. I mean, I was working a lot, and she knew what I was going through. She understood. And that was super, super important to me because it wasn't like a make or break thing. And so, yeah, it's awesome. I don't think I tell people I'm with my wife 23 hours a day. That she's working out and doing some other things, but 23 hours a day, we're working together, we're doing everything together. And I couldn't have it another way. I mean, and yeah, and she's a huge motivator on what I do in my practice. And she always just brings me back to what we're doing here. What we're doing. We're adjusting these patients. Don't overthink it, man. They need an adjustment. She's the one that tells me that stuff. It's that nurturing, just like you said. You're like, dang, they know it.
They do. I know that we got about 15 minutes left of our conversation today, so I want to make sure that we touch on the topics that we want to discuss. Um, Chiropractic hospital. I know that back in the day there was a Spears Hospital in Denver, Colorado. What's your vision on chiropractic hospital and a multidisciplinary clinic with multiple docs?
That was kind of my first vision when I was in school, which kind of goes back to your other question of like, what do you tell these students like coming out? You got to make dreams. You got to think about dreams, because the more you create these dreams, they turn into goals and they turn into reality. And when I was in chiropractic school, I told my wife, well, we were dating like at T2 or that second try. And I was like, I want a multidisciplinary clinic. She's like, well, what do you mean by that? And I was like, well, look at all the things that go on. I'm not going to learn NUCA and I'm not going to do all these things. We need a multidisciplinary clinic. And so I thought about that back when I was in school, early years. And the funny thing is I didn't really think about it until I was listening to one of your podcasts and you were talking to about, I don't know who it was, but you're like, there needs to be a multidisciplinary clinic or a hospital ran thing for chiropractors. And how I think that should be is that we can't reinvent the wheel. We got to do what the hospitals have been doing. Got to have an administrator. You got to have all these different entities, and then you got to have chiropractors that are willing to, stay in their lanes, right? And being like, this is what I'm going to do, and this is what I'm going to do. But you got to have somebody that's going to administrate them, and kind of go in and say, okay, you got to have like almost like everything that people think about with a medical model, that's what chiropractors can be doing. We do it the same thing. We just have a better philosophy. We have a better science about it. And think of how many people we could be helping.
Well, the other part of this, Dr. Bjorn, is you could have it set up to where it's open hours all day long. Like if you really wanted to, you could run it like a facility like that. You could have people working different shifts to where somebody would always have access to chiropractic. And that's been one of the things I noticed as I got into the profession is the chiropractic hours really don't serve the patient. It actually serves the practitioner, but not the patient. So if we really wanted to make this thing better, we would start out 7 in the morning, 6 in the morning, and we'd run this thing till 10 p.m. or 11 p.m. And we'd have shifts of people that would go in and work the earlier, the midday, and the late day. And you could definitely see how access would definitely go up. See, I think one of the hamstrings in the profession is we always want to talk about the numbers percentage of people using chiropractic services. Well, people would use chiropractic services more if chiropractors were open more. And I think that that's a real issue too, is the access point of people wanting to talk about the lack of numbers annually seen by chiropractic. But I think when you think about the sheer number of chiropractors in the United States, 60,000 chiropractors serving, I don't know what the population of America is, but it's millions. So if you take an army of 60,000 and you're seeing 10% of the United States global or that population, that's a pretty significant number, in my opinion. Like you're it's not a downgrade statement. It's actually, let's applaud ourselves for seeing 10% with a workforce of 60K. Like that's pretty impressive in my opinion. And I've heard a lot of people that want to talk down on that number. Like we're not doing enough, or we haven't seen more people grow over the past, X amount of years. And I'm like, but if you think about the sheer volume of chiropractors and the sheer volume of population, 10% is a massive number. But that's my soapbox moment.
No, but you're 100% right. That's why when you get into those towns and you see there's 20 chiropractors in a town of 20,000, people are like, oh, there's too many chiropractors. They're like, yeah, if we're all seeing, the 100% of the population, but we're not, you know what I mean? Mm-hmm. And so I think a medical or, a large chiropractic office setting like that would be great. But the thing that I think is the hindrance of us is that we're all private practice and I'm going to create it my way. And this is how I'm going to do it. And the other thing is you're going to be taking money away from me. This is how I feed my family. This is how I do things. And when you get into that sole proprietor thing, I think that's kind of the thing that we're seeing is that, like, for instance, like when I first came out to practice, I'd be like, gosh, I'm not going to go down to chiropractor A down the street and have him come work with me. I don't like how he adjusts or whatever. You know what I mean? So it's like, I think it can happen, but it needs to be chiropractic schools, that's how it's ran. You know what I mean? It's ran just like what we're talking about at chiropractic school. You got all these different clinical docs that are there and you get an intern, you get to intern with all these people within the school. It's exactly how it's ran.
That's what people don't understand in the mass marketplace is that chiropractic is an art and the adjusting technique is the art. And when the chiropractor goes through their matriculation of education, they become the artist. And that's a lot of the stuff that people don't really know. And people just think that they get their bones cracked or popped. Well, not really. You're getting a specific, adjustment based on somebody's 7 years of education on how to move a segment that's subluxated back to taking the pressure off that nerve, which people just like, well, I just want you to crack me like a glow stick. And you don't want that, because I tell people all the time, is like, just because the bone moves doesn't mean it's good for the nervous system. And just because we can get the bones to move and the segment to give an audible doesn't mean it's good for your nervous system. So the less movement, sometimes the better. So trust the artist, allow them to do what they do and pay them well for it. So, but I know we wanted to get into talking about Black Hills Chiropractic Society and leadership. I don't want to end today's conversation without at least touching on Black Hills Chiropractic Society and leadership. Share with me a little bit about your position and what it means for you to help with the state of South Dakota.
Yeah, so Black Hills Chiropractic Society is a society of chiropractors in the Black Hills region, which is kind of the western portion of South Dakota in this little mountainous region. And it was designed to really focus on chiropractic in this region, because South Dakota is kind of broken down into two different regions. You got Eastern South Dakota and Western South Dakota. And the two bigger towns are on the very edge of the state. So we're 10 miles away from the Wyoming border, and the other big portion of South Dakota is Sioux Falls, which is 10 miles away from the Minnesota border. So trying to create education and things like that for everybody to be able to be a part of became hard. And so Chiropractic Society of Black Hills became a part, I want to say like 30 years ago. And the big thing that we push is just getting people's hours. State requirements in South Dakota are 40 hours per 2 years. And so we try to get these chiropractors, local chiropractors, their hours. And if you can do our course 2 years in a row, you're going to get pretty close to those 40 hours. And that's what our thing. So we do like CPR. It's all really educational based, and it's all grassroots chiropractic driven. My wife and I are organizing it, designing the entire thing. We don't sell it off to another company. We do all the advertisement, and we handpick all the presenters. And yeah, it's a really kind of, we try to just keep the grassroots of education and try to get these chiropractors new ideas, new philosophies, new techniques, everything you can think of. We kind of just blend it in, and it's a 2-day thing, and it's a lot of fun. And a local chiropractor, and you guys had him on the show, Dr. Nick Creasel. He came up to me and says, "You got to do it. You're going to take over this." And I was like, "Really?" And I was like 2 years out. He's like, "You're going to take it over." And I was like, "Oh, really?" And he's like, "It's going to change your life, and it's going to change your practice." And that's all he told me. And he gave me kind of the base breakdown of what it was about. And he wasn't wrong. As far as the revenue that I've gotten, just the positivity of my practice boomed because becoming a leader in that. And so then from there, I joined the state association, which we call the South Dakota Chiropractic Association. And I do leadership with that. And I do foundation for scholarships for incoming chiropractors in the state. And then I just help. My biggest thing actually is I'm trying to get continual funding to keep it running on a high level. And so, so Black Hills Chiropractic Society, we do a conference once a year. It's on the 25th and 26th of September in Deadwood. And we have a good time. We have meals, we pay for everything. We have, like happy hours. We do a bunch of stuff, but the whole premise, get your hours, have a good time. So, yeah.
Really cool, man. Well, I appreciate you making time today. My big ask for you is let's get your wife on and let's get your dad on and get some more Chiro Hustle interviews scheduled.
Yeah, that'd be awesome. Yeah, to be honest with you, I think you only need to get my mom, because my mom is she's not a chiropractor, but she's like you. She's my biggest advocate. People come out of their rooms and they're like, "Oh my God, that was so amazing." She goes, "That's a chiropractic miracle. Don't you know that?" And they're like, "Oh yeah." And she's just a walking billboard for me. It's awesome. So you could have all my family.
Well, let's get them all lined up, man. I know that we didn't get a chance to, talk about everything that I wanted to cover today with you, but is there anything I didn't ask you that you want to make sure we cover before we close out today's interview?
I think the biggest thing is my big motivation is to get we have to do something for this younger generation of chiropractors coming up. And if it's monetary, giving them some money or anything, we just have to do a really good job to keep them interested in chiropractic, to push them into chiropractic, to help them in chiropractic, because they're our legacy, like it or not. When I'm gone, I got to figure out somebody, if it's not my kids or anything, whatever, they're got to be taken over. And we got to do a better job of and we could go into multiple things, but if that's changing prices of chiropractic school or whatever, I mean, that's my goal. Is I want to get these kids so they're excited to get out and they're excited to be adjusting and they're excited to help people, because I'm telling you, there's more and more people, they want to get adjusted even if they don't know it or not. I mean, it's the bottom line.
I'm here with you, and I appreciate you making time today. Your episode 761 of the Chiro Hustle podcast. Looks like we'll have to tee you up for a part 2 here eventually sometime. And let's get your family scheduled. And today was it's a really good interview. Appreciate your time, man.
Thank you.
And enjoy your night up there in the beautiful Black Hills area. And let's bring the new year in strong, and let's have more fun. And I look forward to some more fellowship with you at your convention up there. And I will close out like I always do. I tell everybody, you guys are just one story away. Keep hustling. I'll see you guys on the next episode. And we'll see you soon, Doc.
Thank you. See you soon.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.